Hi, welcome to the Coronavirus, Your Health and the Future webinar hosted by Willows Health in conjunction with the Leicester Primary Care Networks. So this is the second webinar we've had. We had a webinar 2 weeks ago, and that webinar was tremendously successful. We had around 5,000 people across Leicester join in. And during that webinar, it was fairly obvious that there was a need for people to be engaged with questions that matter. And there were over 600 questions asked through the course of that particular webinar. So there was a real need to engage people with answers from various specialities. And it's really a outcome from that webinar to have a panel of experts who deliver care in the NHS locally to the people of Leicester and beyond. Now, there's been a bit of coronavirus related news over the last few days, and we were actually expecting an announcement from central government today. And at the moment, we're waiting on that announcement, but we've got really the main man with us today, and that is Professor Ivan Brown. But joined with us, we have a number of panelists. And our panelists joining us today are Dr. Irene Valero Sanchez, and she's a respiratory doctor working at the Glenfield Hospital. We have Dr. Srinivas Naik, who is a consultant in adult psychiatry. We have Jeanette Bowley-Williams, who is a consultant clinical psychologist working with children. We have Dr. Rob Hampton, who is a GP, who's going to be talking about your occupational health issues or workplace issues. We've got Dr. Richard Wong, who's a consultant in older people's medicine, who's going to be talking about older people's care. And we have Dr. Aruna Garcia and Dr. Rajiv Wadhwa, who are both GPs who have been serving the people of Leicester for many years and really have been quite instrumental in shaping primary care and general practice in the city of Leicester. So without further ado, I'm going to take it to Professor Ivan Brown. And I think the question on everybody's lips today is, Prof. Brown, where is the update? We were expecting an update by now.
Well, yeah, yes, so was I. I've even got my interview suit on today because you know I was expecting to be doing that today. So the process that we have in relation to this is that there are a series of committees that a decision goes through, government committees that go through, which include the Chief Medical Officer, the Secretary of State, and then there will be also a meeting with the Prime Minister. And it's after it's gone through those different processes that the announcement is made. Now, I'm sure that many of you are aware that this is no longer just a Leicester concern, and we've had places like Oldham and Blackburn starting to show real case numbers there as well. Luton, I think, has been in there, and a number that are coming up. So my thinking is that maybe at this moment there is looking across the piece in relation to that announcement, so that it probably won't be just Leicester, but there'll be additional other areas where they might want to discuss as to where they've got to. So my understanding is that there may still be an announcement. That announcement may be around the 7:30 time. So please, if you see me disappear for a few minutes, don't be alarmed. I'll be on the BBC website to see what that's saying. So this is a live webinar at its best.
Thank you, Professor Brown. Really useful update. I think on that, it would be useful to know what's happening in Leicester and the numbers of coronavirus cases and people dying from coronavirus, perhaps. So is the lockdown working, and can you sort of give us a rough idea as to what the trend is showing at the moment?
Yeah, absolutely. And it's interesting. Is the lockdown working? That's an interesting one. I think what I would say is the people of Leicester are working, and the people of Leicester have respected the restrictions that have been placed on them. I think lockdowns can be quite blunt tools, but nonetheless, I think that the city and the people there have responded, and that's really evident in terms of the numbers that we're seeing. So if you remember when we were here last time, it wasn't too long after that period, we were at, you know, our numbers were coming down. We were still, I think we were about 112 per 100,000. And prior to that, I think we started this whole journey at about 136 per 100,000. in terms of the data that I'm seeing now, the confirmed data says that we are at 64 per 100,000. And I had a quick look before on some of the other sites to see where our trend is going. And if you take the lag out, because the confirmed data has a sort of 3 or 5 day lag to it. And if you start looking at taking that out, we're actually below the 50 per 100,000, which I think people know internationally is a kind of marker that you're definitely heading in the right direction. So for me, it's real commendation to the city, the response, the way that people have gone and had their tests and they've isolated and they've done all the things that they can do as a city to get us in the best position possible. So good news. Positivity figures are coming back down from that 13% that we had at the beginning, and now we're at 2%. So just gives you an indication of how much work has been done.
That's really useful, Professor Brown, and of course our patients have been working tremendously hard to really accommodate the advice that's been given from public health, and it's really pleasing to hear that those numbers are coming down, and it shows what we can do as a city when we come together and take that advice. And I very much hope this means that we'll be coming out of lockdown soon, because it seems as if this city can hear and understand the messages that public health are giving. Now, in terms of going back to when we had the peak, there were lots of questions about why it was that Leicester had a really high number of coronavirus cases. And a few weeks ago, we only had a little bit of data to advise as to why this might be. Is there any firm data coming out now from which we can base any conclusions as to why Leicester has been hit so hard?
So this has been, from an epidemiological point of view, this whole thing has been, whilst frustrating, has been quite fascinating. So I remember when we were there before, we were talking about, you know, is it from workplaces? Is it from events? Is it from all of these different things? The more that we've looked at the data, the more we've realised that it really does seem to focus on household transmission. It really does seem to be about, you know, how we're crossing this into our communities. But the fascinating bit particularly is what we're not seeing, you know, is that transmission going into the vulnerable populations. We're not seeing it in, you know, being reflected in our care homes. Very much we're seeing a kind of younger age population who are you know, by and large, were getting their way through this. So the big thing that I was really worried about was, are we going to start seeing, you know, general practice tipping over? Are we going to start seeing our hospitals tipping over? Are we going to start seeing, you know, a high number of deaths within care homes? And I have to say, at the moment, that does not seem to have been the case, which for me is, from a public health point of view, is a huge relief, because that is fundamentally the big thing that we're trying to avoid. And I think we're doing that really well.
Thank you. And you know, it's really reassuring to hear that it's the younger age group who have been affected more so than the people at risk. And is that being translated into hospital and what's happening in hospitals? Are we seeing an equivalent increase in complications and deaths from coronavirus as a result of this uptick in cases?
The short answer to that is no. And that's really reassuring. It's quite interesting that this community sort of household spread is the same sort of pattern that we've seen in Blackburn as well. So even though Blackburn, you know, had the information and knew that might be heading their way, if you saw how quickly that just spiked up and went, it just shows how difficult it is to sort of manage these kind of community spreads. But the great thing about it clearly is that the people that are involved and those communities that are involved and those places in the city that are involved are clearly taking action to make sure that they limit how that goes within their households and are responding to it. So it's good news on that one.
Thanks, Professor Brown. Really useful. And we can see these sort of cases of COVID. There's been spikes in various places, and people have been wondering whether this is correlating to a second wave of coronavirus. Is this all related to a second wave with what's going on in Europe, or is that still yet to come? Or do we not know?
Yeah. The jury's out on that. I think that we are at a relatively early stage. I mean, some epidemiologists shy away from the idea of first and second waves and sort of say, well, actually, it's all part of the ebb and flow of a single wave. So what we are seeing, the spikes that we're seeing at the moment, if you compare those to the levels that we were seeing back in March, etc., they don't compare to what was happening then. But what we are seeing are these localized spikes that rise and fall. And I think we've just got to keep a really close eye on that. And I think the one thing that I can say from the experience of Leicester is that we have now put into place we've been at the cutting edge of governance, development of new interventions, testing regimes, all of that kind of thing. So from this difficult position, I would argue that we are probably more equipped than probably anywhere else in the country in future to be able to monitor, to identify, and to address those kind of spikes that we may see over the course of the coming months.
Thanks, Professor Brown. And in that statement, you've actually answered a question from an audience member, and they were asking what plans are in place from a second spike. And it seems very much, actually, we've got testing process actually all ready to go. We have the hospitals who are equipping themselves. You've got the general practitioners who are working hard to really optimize people's chronic health conditions. And we'll come on to that just a bit later, because we've got a fair few panel members who are going to be talking about their relevant area of expertise. And just to track, this is a Q&A, there is a live Q&A. So if there is a question that is burning on the tips of your tongues, then please put it on the Q&A. We have some moderators who are senior clinicians, doctors in Leicester, working on the front line, and they will be answering your questions on the chat. But any particular questions that really stand out, we'll take to the panel. There may be lots of questions which come through, and we'll try our real best to answer them through the course of this webinar. So I'm going to move on from Professor Brown, and I'm going to come to Dr. Garcia next. And what we're going to be talking about is the patient journey of coronavirus. And what I really want to give our patients and people of Leicester a feel of what happens if somebody develops coronavirus. And I know we've been through this before, but because it's such a rapidly developing area and so many things are changing so quickly, it's just useful to go through that. So what I'm hoping to get exposure of is what happens if somebody gets coronavirus, and then we'll sort of move the conversation on to our consultant lung doctor, who's going to tell us about what happens if you have to be admitted into hospital. So Dr. Garcia, welcome. Thank you very much for joining us. I know you've been really working hard on the front line. So you're at home and you develop typical symptoms of coronavirus. What do you do? What do people need to do?
Thank you, Dr. Kapasi. I think it's just a reminder, I know we've heard it from everywhere, but just to remind everybody of the kind of symptoms that you can get with coronavirus might be useful. And don't forget that we can get, so the usual symptoms that people hear about are the new onset of a fever or a cough, with or without sputum. You sort of start to think, have I got coronavirus? Or an altered sense of taste in your mouth or your sense of smell. Just want to remind you that there are other symptoms that you can get that are a little bit milder. So general flu-like symptoms, having a runny nose, sore throat, or sometimes people will describe body aches and pains. I think sometimes some people will come back to you and say that they may not have any of these symptoms, but they might just be feeling a lot more tired than usual. So they'll describe fatigue. So in any of those situations, just think corona and think about whether you should get yourself tested And you do that, remember, by calling 119 or going onto the NHS website and logging on for a test, where you can book yourself into a local testing centre. Just finally, if I may, just remind you that sometimes in our older population, our elderly relatives or our elderly colleagues may not present with such typical symptoms, and we've got to remember that they may come to you just being off legs, just not feeling right, just being a bit more confused than normal, or etc. So always in those situations where you're not quite comfortable with, they're not right, make sure you think corona, because they may not have a temperature and they may not have a cough.
Thanks, Dr. Garcia. That's really useful, and I think it's really important to remind ourselves of that really sort of simple but important advice. The other thing to just remind ourselves is if you have symptoms of coronavirus, you need to book a test, and you can do that by calling 119 or going to the NHS website. And there are lots of testing centres within Leicester City itself, and I know that lots of volunteers have actually gone door to door to actually test people. So Dr. Garcia, you're at home, you've got coronavirus, you call 119 up, they organise a test for you, you go into the testing centre, you have your test, the test comes back as positive, and you're at home nursing your symptoms. And I think it's really important to remember that most people have really mild symptoms. But what do people do if they start to become more unwell? So let's say you start to feel really short of breath or really unwell. What do you do? Who do you call? And where do you go from there?
I think if you're feeling short of breath, so there's a bit that we need to remind ourselves of. Corona, if you are positive for corona, sometimes it can get a little bit worse before it gets better. So be vigilant about your symptoms. And if you are worried that you're feeling worse, make sure you call for help. I think shortness of breath is something that makes us a little bit more worried that you might have more severe coronavirus. And therefore, in that situation, if you're feeling short of breath but can hold a sentence, it might be good to call 111 to get support and to find out what to do. But if you can't quite hold a sentence, it might be better to call 999 and be seen a little bit more urgently.
Thanks, Dr. Garcia. And I suppose there's another element as well, isn't there? There's the hot hub. So often what will happen is that you'll call 111 and they'll sort of defer to the GP, and the GP may actually speak to you on the phone, and it could be that you need to go and see a doctor to see whether you need any further treatment. And as far as I understand it, there are some hot hubs in the city. And could you just tell us a little bit about the hot hub process and how this differs from the normal way people access GP care, Dr. Garcia?
Of course, Dr. Kapasi. So hot hubs are special clinics that are manned by doctors with the right kind of personal protective equipment, PPE, that enables them with the right clinic environment to see patients that may have COVID symptoms. And essentially what happens is that remember I said if you're feeling short of breath or a little bit worried about your symptoms, or we think you may have COVID or contact with COVID in the background, we would prefer for you to be protected from other people, and in turn from other people to be protected from a potential risk of catching COVID. So that's why we prefer you to be seen in a hot hub. In that situation, it's just like seeing a normal GP in a normal appointment, except with the PPE. And they may choose to examine you. They may, as other GPs are doing at the moment, they're going to be assessing you on the telephone first, usually, and just to see what your symptoms are like, to evaluate you, to make sure that we can think about other things, and to make sure that you don't need to be seen more as an emergency through 999, basically. So you will receive an appointment at the hot hub to go down if the GP feels that they could see you. And usually what happens is it allows for the GP to perform an examination for you, and more importantly, to be able to check your oxygen levels. It's called your oxygen saturations, which tells us whether this could be coronavirus and whether this could be severe coronavirus.
Thank you, Dr. Garcia. That's really, really useful. So we've got a really interesting question on the chat, and And we have a question about concerns about GP surgeries not opening. And I think patients may need some clarity as to exactly how GP services are being delivered, because as frontline clinicians, we certainly are sort of seeing our patients day to day, but slightly differently compared to normal to protect patients and staff, Dr. Garcia. So could you just reiterate how we've modelled general practice to keep our patients and staff safe?
Absolutely. I think it's really, really, really important that we all, as GPs here, emphasise that we have stayed open as general practice, and we have continued with as much as we can to provide services with our patients. What we've had to do with COVID is to make sure that we have been able to protect the staff that work in the NHS and protect patients that could be coming to see us. So therefore, with COVID in the community, and to make sure that we protect those people that I've just mentioned, what we've had to do is move a lot of our services over to what we call a virtual service. So that's where the telephone, so that our patients in the community are essentially experiencing contact with their surgery on the telephone or video consulting, but the access is still the same. If on that consultation, you or the GP feels that a face-to-face appointment is absolutely required, and the benefits of you coming in with that risk of COVID outweigh those risks, then you will be advised. We are definitely still seeing patients in the surgery with PPE, but of course, we're only doing that and we're only exposing the risk if it's absolutely necessary. And I think I want to add, one of the things as Professor Brown has said, is that COVID hasn't quite gone away. Although we might come through, hopefully, lockdown soon, COVID is still around, and therefore we need to continue exercising precautions all the time, and we need to make sure that we are careful. So it's likely that with general practice and in the NHS, we will continue to make sure that we're protecting our staff and patients, and it's likely that we'll continue to make sure that we are operating a service through telephone and virtual consulting, whilst trying to recover our other services that we used to enjoy before in the process. Thank you.
That's great, Dr. Garcia. And it is a fundamental change in the way we are practicing as GPs. There are quality checks that we're implementing, and this is just to reassure our patients and PPG chairs to make sure that because we're consulting differently, it's not leading to problems down the line. So we're fully open, we have access by telephone, access by video, access by app, and those people who really struggle, we still see them face to face, and these practices are still fully open. We're also performing something called an audit, where we look at individual case notes to see whether seeing patients differently has caused problems down the line. And at the moment, the data which we've reviewed in its hundreds has shown that there has not been an increase in the number of what we call significant events or misdiagnoses. There is a way to go to refining this process, but we can reassure many of our patients that this process is working. So thank you to that member who asked that question, and through the course of the webinar we will be answering some of the questions on there. We just have a slight structure to run to, and we'll be asking some of those questions towards the end and with each panel member if relevant. So Dr. Garcia, thank you very much for that series of questions. Now I'm going to come to Dr. Irene Valero Sanchez, who is a consultant respiratory doctor working at the Leicester Glenfield Hospital. And that site at the Glenfield is really seeing the brunt of coronavirus cases. So Dr. Garcia has spoken about what happens if you get coronavirus and you're more unwell, and if you're seen to a hot tub, and let's say at a hot tub you're actually looking really unwell and the doctor feels you need to go into hospital. So you go into hospital, what happens from there? Where are you taken? Is it A&E? Is it the Glenfield site? What can a patient expect, Dr. Valero Sanchez, and what's the journey? So we'll take it to Dr. Sanchez. Thank you very much for joining us.
Hi, good afternoon. So it really pretty much depends on the situation of each individual patient. So in Glenfield, because we are the respiratory hospital, we usually see all the patients with pneumonia, and we may tend to see a slightly younger cohort of patients compared to other sites, as for example, the Royal. But I will say patient journey, once arriving to hospital, patient will find a very different situation that they may have found compared to, let's say, 1 year ago. They will arrive to a place where everyone's wearing a mask, so everything is different. So there's strict infection prevention measures in place. Social distancing is being kept very strictly, and they will wear a mask. Everyone will wear a mask and gloves and a visor. So it's a different situation compared to before. And then in the same way, because we need to be very strict with infection prevention, we are not at the moment. I don't think it's appropriate to get too many relatives around coming to hospital, because there's always risk of infection and transmission of the disease. And then once they arrive into hospital, it will be usually a bit of a more unwell cohort compared to the one that we will find in the community. So they will come in, they will have a nurse asking lots of questions and just taking the observations, including oxygen levels, including blood pressure, including temperature. They should expect an X-ray just to make sure, to check for COVID pneumonia. Other tests such as an ECG, also blood tests as well. And then they will get a swab, a COVID test, which results are usually not immediate. They take a little while to come back, usually 1 or 2 days. And then once we put all of this together, they're usually assessed by a few doctors, and then we will just put together what the patient is telling us, the symptoms, the X-ray, the results. We can pretty much make a diagnosis even without the swab result. So COVID has a typical representation that we can easily in many cases diagnose, and then we start treating according to the suspicion of that we see of the disease. So we don't really lose time. We don't really miss a minute. So we start treating for the moment that we suspect that there is a serious condition. And then we also determine whether the admission is needed. So if the patient needs to stay in hospital because they're very poorly and they have a severe enough disease to require admission, they will be admitted. And then if they are safe or well enough to go home and be treated at home, then they will be discharged. And then in that case, the swab results, once they come back later, if they are positive, they are communicated to the patient, and we advise just to even whilst they are waiting to the result to come back, to consider this episode as if it was a COVID disease, so act as if it was COVID until the result is back. So the advice when they go home is the same as if there was a suspicion.
That's really useful, Dr. Valera Sanchez. So I think the first thing to remind our patients is hospitals and GP practices are taking all the precautions that they need to ensure that they do not transmit COVID to patients. I've had patients myself actually not wanting to go to hospital for really quite serious medical problems. And I think we need to really remind our patients that if a decision has been made for you to go to hospital, then it's likely to be in your best interests. So Dr. Valera Sanchez has said you go into a hospital, you could go to A&E, you could go to the Glenfield Hospital directly, you could have a blood test, ECG, chest X-ray, you have a COVID swab, and hopefully from that point forth, a decision is made to send you back home, or a decision is made to admit you. And many of the complications from COVID mean that it does affect the lungs, and people become more short of breath. So let's say you go into hospital, you're looking well, you need to stay in, your lungs are having to work a bit harder. What happens then? And just take us down that sort of route of what happens if there are complications from coronavirus, Dr. Valera Sanchez.
Yes, so the situation that we may find now has also changed compared to the beginning of the pandemic. So one of the many things that was, for us clinicians, really hard was not having an evidence-based treatment to give to patients. So in the very beginning, the treatment was supportive. So what we did was support the body to fight against the viral infection. But now, as you know, and I'm sure you've seen the news, there are now we've now got a couple of evidence-based treatments that we can use, and I'm sure you, as you're aware, as you may have seen in the news, Leicester was the main recruiting site for the recovery study. So now we have two therapies we can give to patients. One of them is dexamethasone, which, as you will all know, is an anti-inflammatory drug, which reduces the inflammation in the lungs. And we also have we can also give remdesivir to some patients. So there are criteria, certain criteria that we have to base our decision to. So now there's some hope to make things better. And then once the patients are admitted, depends on the situation. So if there's COVID pneumonia, they will need oxygen therapy to help just to supply the extra oxygen that the body is missing as a consequence of the pneumonia. We'll also give, if there's dehydration, because I mean there's usually fever, so there can be a bit of dehydration. So we give hydration to our patients as well. And then if one situation we find frequently is that the condition decompensates any other diseases, any other conditions. So if there's diabetes, that can also be decompensated, so we need to manage the diabetes as well, blood pressure as well, so that there's a combination of other conditions we need to treat as part of the approach. And then what we find is that if the disease, let's say, progresses and things don't really go well, and the pneumonia becomes more extensive and worse, then at one point we just move to high concentration of oxygen, and at one point we may need to give ventilation, which can be given in a way of non-invasive ventilation, which is given through a mask. It's the CPAP or the non-invasive ventilation that we've seen really often in the news as to many companies just producing ventilators. These are one kind of them. And then if the situation progresses, and if after a discussion and a decision based personalized in every patient, and if we find out that there is a need to may move to more aggressive therapies, if it's the right treatment for the patient, then the other therapy is intensive therapy, which may involve intubation and mechanical ventilation.
Thank you, Valeria Sanchez. Dr. Valeria Sanchez, that's a really useful narrative as to what goes on if you develop COVID-related complications. So there are a couple of medicines that can help. In the main, it seems very much that doctors support the body to get better. We give oxygen, it's very much on the body itself to recover. And those patients who progress with their symptoms and signs, they can have some help with their breathing by using a mask or having a tube. And very much, you know, the people of Leicester don't see these complications, you know, and it very much may not be real to people that there are people going into hospital and having complications and dying from coronavirus. Thankfully, this is a minority of people. And could you give us a flavour of the complications and the people dying in hospitals? Are there people of Leicester dying in hospitals from coronavirus, Dr. Valeria Sanchez? And related to that, what message would you like to give to the people of Leicester from the complications you've seen? Yes, so indeed, during my experience in the front line during the first wave, we've seen all sorts of cases and also, unfortunately, very sad stories. So yeah, people can indeed die from this condition, and we've seen. I have to say that the majority of cases that present with severe disease, we can indeed find it in the, let's say, in the more like 50 to 60-year-old cohort of patients, and many of them have comorbidities. But we have also seen cases of this condition affecting very severely young people, and also those with pre-existing conditions, and also people without pre-existing conditions who were otherwise fit and well. And generally, as I was discussing before, we've seen cases of patients who had other conditions which decompensate as a consequence of this disease. So I will say yes. So we see all sorts of profiles of patients, but I mean the cohort of patients who is usually expected to or thought about just getting a worse prognosis or a worse outcome are usually the latest decades of life and also with comorbidities. And I will say, yeah, that the message I will give to the people of Leicester will be just protect yourself, protect others, just wash your hands, use a mask, keep social distancing, and just look after yourself and your people. That's great, Dr. Valeria Sanchez, and we may actually come back to you if we have any questions relating to your speciality. What I'm going to do now is I'm going to break away and have a look at the Q&A, because I really want to keep this engaging for the people who are using the valuable time to ask questions on this forum. So just bear with me whilst I go through. We've got a question which is asking whether people still go to A&E for non-coronavirus related emergencies. I think absolutely you do. If there is an emergency condition that requires further assessment in an emergency setting, you go to A&E, and that includes children, you know, and we have had very early on in the coronavirus crisis, people not going into A&E because they were worried that they would develop coronavirus, and that's caused problems. Yep. So we have another question talking about how to use an oxygen saturation monitor. And this is a monitor which people use at the tips of their fingers to look at what oxygen level their bodies are at. Now, it's not been recommended in the same way, much like thermometers and peak flow meters, and people want to know how you use them and when they should call for help. So could you give us a particular number or range, Dr. Valeria Sanchez, by which people should be calling for help?
Yeah, so that will pretty much depend on the patient. So patients with underlying pre-existing lung diseases, they may have a bit of a lower threshold. Depends on each person's baseline. But we'll assume, let's say, in a healthy individual, I will say usually the range of 93%, 90 to 93 is the one that we usually start getting worried about. But I will say I need to emphasize that depends on the patient.
That's great, Dr. Valeria Sanchez. I think what it does, it's a great tool for us to remotely assess people. So if you feel as if actually you've got a number on your oxygen meter and you've got symptoms, you call your GP up and they will give you advice. It's probably better not to be making decisions yourself, and you don't need to. We're actually there to take that sort of information and make decisions on that. So I'm just going to scroll up to some of the other questions. I've got somebody who said, I was feeling unwell in the middle of February, and in hindsight, I feel I may have had COVID. Am I able to get an antibody test? Now, antibody tests, Professor Ivan Brown, I'm going to come to, if that's okay. So very briefly, can you get an antibody test, Professor Brown?
So at the moment, everybody would have heard the challenges that we had around getting a reliable antibody test. I mean, the gold standard would be something that, you know, we could just sort of do a finger prick and we would know. That's not what we ended up with in the end. So the use of antibody tests at the moment, there is one, but it's, you know, it is a blood test, and it is being used predominantly within the health and social care settings. So it's not really possible to get one routinely as part of the testing regime that we've got out there at the moment.
That's great. Thanks, Professor Brown. We've also got some work-related questions, and we're going to come to Dr. Hampton in a very short while to discuss work in particular, because it's a really significant thing, really, work. It's really affecting people's finances, mental health, and so on and so forth. So thank you so much to Dr. Valeria Sanchez for those answers. I'm going to move on to a group which is especially vulnerable to coronavirus-related complications. And the data has shown that this group are affected the most, and it's our older people. And we have a care of older people consultant and clinical director of older people's care, Willows Health, and a practicing consultant at the Leicester Royal Infirmary in Dr. Richard Wong. It's a real privilege to have Dr. Richard Wong share his perspectives on older people's care here today. He's done a lot of work on care planning for people in the community. Now, Dr. Richard Wong, can you share some of your experiences of looking after older people with COVID?
Thank you, Dr. Kapasi. I think, you know, you've already highlighted how this has largely affected the older population, and Dr. Valero Sanchez pointed out that, old doesn't necessarily mean that old. Over the age of 50 to 60, the case numbers start to rise in terms of significant COVID infections and adverse outcomes. So I think people need if they haven't already seen the news, more than 50% of COVID deaths were in the over 80s, and that just really paints a picture to the degree of how the older population has been affected. In terms of the patients we've looked after, one thing I would say is that although we do worry about our older people, we have seen, again, a vast range of how the illness has affected them, ranging from those with typical symptoms. We've had those patients also, as Dr. Aruna Garcia pointed out earlier, have the more unusual symptoms. We call these the atypical presentations of coronavirus, and they've included the what we would call syndromic presentations. So older people might become more confused, they might lose their appetite, have reduced mobility, all these things which won't specifically point to one illness, and we should have a low threshold for suspecting coronavirus in such people. So, we've seen people who've had the disease. As I said, many people have had very, very adverse outcomes, but equally, I think it would be also wrong to say that people didn't recover. We have seen many success stories and the dedication of the teams at the hospitals and the rehabilitation teams, and seeing these people through. We have seen some very happy stories as well. One thing which has been quite striking is the isolation, and I think we have realised how the lack of visiting from familiar relatives has actually exacerbated not just the physical but also the mental health of some of our older patients, and contributed not just to loneliness, depression, but sometimes worsening confusion, and that's they've been largely limited to telephone calls, sometimes video calls via FaceTime. These have been some of the ways in which we have seen them affected, and taking obviously prolonged recovery times in many cases due to the effect of the illness.
That's great, Dr. Wong. And we want to know how we can learn from this first wave. We may have a second coronavirus pandemic in winter. And again, it's often our older people who are affected with the seasonal flu. And there is real concern that the seasonal flu and coronavirus this winter is going to put our older people at risk. Now, what practical suggestions can you give to the people living with older people and older people heading into the winter?
So thank you for that. I think, as Professor Brown pointed out, the coronavirus is going to be around, and we really want to stop the transmission to the older people. Now, to a large extent, that appears to have been happening in Leicester since the lockdown. So we've seen community transmission largely amongst the younger working age group. I think the main, the fundamental cornerstone of care and protecting this group involves the social distancing, reducing crowding and chances of transmission, breaking that transmission cycle. That is really primarily what we should be aiming for. And obviously people have been doing this, and there's been, I think we need to pay tribute to the vast numbers of volunteers and informal support for our older population, providing shopping, obtaining medicines and supplies, and running errands for this group of people. So I think the support is largely around making sure that they are shielded and protected, and avoid having to be exposed to kind of sort of busy environments. But I think, as I said also earlier, the side that we sometimes forget about is the mental health aspect, and I think this may be touched on by one of our other panelists later. But maintaining that contact is important for these for everyone. I mean, not let alone our older population, but particularly for people who may not have enjoyed the best of networks at some times, and we need to try and maintain contact, encouragement, so that physical activity is maintained to a safe degree. The other things that we are seeing are that during coronavirus, people have been less active sometimes due to confinement, and this has caused knock-on problems with the other aspects of their health, with other medical conditions that they have. And of course, one of the good things and valuable things you can do if you are caring for an older relative or friend is to make sure that medicines are up to date, because sometimes these things aren't realised, and there isn't the regular access to pharmacy and primary care as perhaps they would have enjoyed pre-coronavirus. So making sure food and medicines are well stocked up in ready supply is one of the other things that I think you can do to help.
That's great, Dr. Wong. Thank you very much for that perspective. And we may just return to you just a little bit later on, once we've got a few more questions from our audience members. And if we get time, what I really want to do is touch on care planning. And it may be that you know, we have a bit of time just to discuss that, because I think that's really important. I'm going to move on to Dr. Wadwa, and we're going to be talking about the impact of COVID on physical health. And really briefly, Dr. Wadwa, what sort of impact have you seen on the physical health of your patients as a result of the coronavirus pandemic, even if people have not been affected by coronavirus?
Hi, Dr. Kapasi. Thank you very much. Yes, you are absolutely right. It's a very important question. It has affected people. It has affected people's mental health, which we'll discuss a bit later with other panelists. But as far as the physical health is concerned, there is obviously worsening of their pre-existing conditions. So, for example, if they had diabetes, high blood pressure, heart problems, now they are probably not as much exercising as they would have been before, because they're not getting out of the house. Maybe because you're sitting at home all day, your eating habits are not as good as they should be. Maybe they have put on weight. Maybe you can't exercise enough, and that then has an impact on your pain, etc. Because if you have chronic pain conditions, then you should obviously exercise as much as possible, but you haven't been. On top of that, there is also issues with people, as one of the panelists said before, not wanting to go into hospital. So they know they are ill. It's nothing to do with coronavirus. It's something else, but they are scared of going into the hospitals or coming to the GP surgeries to get some treatment. That has had an impact. Also, people have been waiting for example, operations, because we know a lot of surgeries have been cancelled because of this. There's lots of people have had their hospital appointments being cancelled. So all that's obviously, all that together has had a huge impact on people's health in general.
Thanks, Dr. Wadwa, really useful. I think really, you know, we need to engage in the simple strategies to keep ourselves fit, particularly during the warmer months. And I just wanted your perspective on shielding. Now, we know that locally in Leicester, the shielding groups have been advised to shield for a little bit longer. And you know, it's very difficult for this particular group because the challenges are greater. Now, what are your suggestions to the shielding group as to what they should do if restrictions lifted after the 17th of August? Because they're going to naturally have anxieties about going back to work, going back to, you know, engaging in the community.
Absolutely, you're absolutely right. These people, to some extent, have been the most hard hit. They've been, in a sense, locked up inside their house for all these months. And you can imagine they would want to, on one hand, go out and do a lot because they've not done it for all this time. But on the other hand, they may be anxious of getting out, because disease, as many of you have already said, has not gone anywhere. It is less, it is reduced, but the disease threat is still there. So it's not that there is no coronavirus. So there is twofold advice I would like to give these people who have been shielding so far. follow up the advice. So we were hoping today we'll get some guidance from the government, what's going to happen. We might hear a bit later. So whatever the advice is, we need to still follow that advice because it's for your own good. When the shielding ends, you still need to take precaution. You might go out, but you still need to follow all the rules that other people have been following all this long, such as not going into crowded areas, wearing face coverings, continuing to socially distance, 2 meter distance, wearing face coverings, as I said, and washing your hands regularly. So those are the real keys of avoiding getting that infection.
Thank you, Dr. Wadhwa, and it's really useful to have that reminder because often we forget the simple strategies to protect our vulnerable groups. We're shielding our older patients, as Dr. Wong has quite rightly clarified. So these strategies are really important. I'm going to move on, and we may come back to you, Dr. Wadhwa, to talk about physical health. And I wish to talk about children's mental health, and it's perhaps an area that I myself as a GP have not seen too much, particularly the more complex sort of mental health issues which may arise in children. We have Dr. Jeanette Bowley-Williams, who is a consultant clinical psychologist who's joined us today. She's got lots of experience working with younger people and children. So thank you very much for joining us, Dr. Bowley-Williams. What effect has the coronavirus pandemic had with mental health in children?
Thank you, Dr. Kapasi. Yes, and a really important question, I think, and I can see from the questions and answer section that one that lots of parents are understandably very worried about. It may not come as a surprise, really, but actually the impact has been incredibly varied. And so we've seen a real diversity of how children and young people have responded to this. I mean, interestingly, most children and young people are not hugely concerned about the virus itself. So they seem to have got the message that it doesn't have the same physical impact on them. So some of the impacts that we're seeing are secondary to that. So the impact of lockdown and perhaps the impact of some of the other factors and concerns that are coming into play. And this seems to really depend on the child, family factors, as well as some of the different circumstances that they were in. Oxford University are tracking this at the moment, actually, which is really interesting. Some of those emerging findings are coming out. So they're doing a survey looking at how children and young people are responding to lockdown, and it'd be interesting to see that track through as the pandemic moves forward. Interestingly, some children and young people are actually reporting that their emotional well-being they feel is better during this time, particularly our older children, so our teenagers, and maybe more so related to perhaps children and young people who perhaps find school difficult. So there have been some real benefits for children who live in safe and secure homes, having more family time and perhaps some less pressure on them. So hopefully that's reassuring for some of the parents on the chat. But we do know that this isn't true for all young people, and some young people are much more vulnerable to the impact of that. So those groups may well be children who already have existing mental health conditions or neurodevelopmental conditions, children and young people who perhaps living in less safe environments, or perhaps with families where there are less resources. So, you know, family tension is greater for them. The risks associated with lockdown are the same, I guess, for children as for adults. So it's related to the kind of social isolation, lack of structure and routine, and lifestyle really changing. And what we're seeing in some of those children and young people are higher levels of anxiety and low mood, which may well come out for particularly our younger children as being more clingy, impacting on their sleep, being more irritable, and some tricky behaviour, which I think has also been mentioned in the chat.
Thank you, Dr. Bowley-Williams. So really reassuring to hear that there are a group of children who are reacting very positively to COVID, because I think we need to reflect on the things that are going well, and often we forget on those bits. There's a question on the chat about parenting strategies, and many of us who are parents will have noticed that perhaps our children are behaving a little bit differently compared to normal because they don't have the normal peer interactions, and the normal parental strategies aren't working. There's a question on the chat about parenting strategies and how could we adapt parenting strategies to meet the needs of children in lockdown?
Yeah, absolutely. I suspect we're all behaving a little differently at the moment, aren't we? So, and you're right, I think that's understandable. I think for any difficult behaviour, I think what we need to remember is it happens for a reason, and that reason is usually an underlying need, and this is the way that children communicate that need. So our first language is behaviour. So in the absence of children being able to recognise or verbalise what's going on for them, that will come out in their behaviour. So I think for parents, it's important to recognise that is a form of communication. So that need might be, you know, hungry, thirsty, tired, frustrated, anxious, bored, all those types of things. So whilst as parents and carers, we may well have to put limits on that behaviour depending on how severe it is, we also need to recognise that that's a short-term parenting strategy. And our long-term parenting strategy is about helping children and young people to recognise that need and to verbalise that in an appropriate way. And that takes time and needs to be done at a developmental level. So for me, I think that is about kindness, compassion, connecting emotionally with children before you correct them, and trying to help them to do that in an appropriate way. So we need to think about what we're role modelling as parents and how do we communicate our needs, how do we express our frustrations and manage that, but also I guess being kind and compassionate to yourself. This is a tough time, tensions are high in lots of families, and children don't need perfect parents, they need parents who are good enough.
Thank you, Dr. Belly-Williams, really useful. Now, in short, do you think the lockdown is going to have long-term psychological implications on our children?
Potentially, and that might be a bit of a cheat answer. I mean, certainly the evidence that emerges from previous pandemics is that the mental health footprint can be quite large, and we know that anxiety and fear can be contagious, possibly as contagious as COVID. So we do need to be careful about where our children are accessing their news and information, keeping an eye on social media and making sure that we're giving them developmentally appropriate information and sharing that with them. I mean, I think the two things that really spring to mind for me is we know that for adults accessing mental health services, about 75% of them say that their difficulties started in adolescence. So we know it's a high risk time. And we also know that loneliness linked to social isolation can be a risk factor for future depression. But it does seem to be, it's about how long that loneliness goes on for rather than the intensity of it. So we can tolerate short periods of intense social isolation, but the longer that goes on, the more difficult it becomes. So I think other panelists have mentioned that. For me, this is about social connection, even if we're physically distancing. For me, I think going forward, and again, I think it's been mentioned in the chat, this is very much how we emerge from this as services and what resources we have and how we manage to operate mental health services in the new world. So we know that during this time, access for urgent mental health care has increased in children's services, but access for routine has significantly decreased. So both in terms of new referrals coming through, as well as children who are already in our service accessing our service, and that may well be linked to fear of accessing services or difficulty using kind of telephone and video consultation. So this will very much be about how we manage that backlog going forward and start to introduce new ways of working to support people.
Thank you, Dr. Belly-Williams. And of course, I think we're all going to be trying to find really innovative models of care to try and manage our increased workloads in different ways. Really useful perspective. Can you signpost us to any support that might be available for parents?
Yeah, absolutely. So the NHS UK site is actually very good. There's lots of information on there. I'd also recommend Young Minds and Mind as organisations with lots of useful information. The Anna Freud Centre has some really good resources to use to explain coronavirus to children, with some really nice resources for young people. And for those of you parents out there struggling with difficult behaviour, I would highly recommend the No Drama Discipline book by Daniel Siegel.
Thank you very much for joining us, Dr. Bailey-Williams. And if we've got some time, we may actually sort of ask any further questions that our audience may have. Okay. So far we've heard that it's really useful to get a perspective from different professionals, because it seems that everything is impacting everything else, and children's mental health impacts on adult mental health, and the themes of loneliness and isolation and being shielded or having chronic health conditions seems to be really quite apparent from this talk today. I'm going to move on to Dr. Srinivas Naik, who is a consultant adult psychiatrist working for patients on the front line in Leicester. It will be really useful to hear what's happening with mental health in adults. So, Dr. Naik, what's happening in mental health in adults as a result of the pandemic? What are you seeing?
What we are seeing is a wide range of new phenomenon. If we think of this pandemic and how we cope in general in other situations, right from our childhood, we are exposed to various kinds of stresses. We learn coping behaviors, but this has hit us in a totally new way. None of us, our parents didn't teach us how to cope with the pandemic. And what's happening is it's affecting people's routine right from the morning till night. People get up, go to their jobs, they have kids they take to school, they have evening activities, gym, sport, they meet up. Every aspect of everyday life has been hit by this pandemic. And what we are seeing significantly is a high element of social and emotional isolation. This is the core of all the difficulties most common people are facing. And then you have the aspects of financial difficulties. Some people aren't as affected and some others are really affected because of financial difficulties. Then people have access to a lot of their own routines and coping strategies. That's not available now because of the lockdowns and restrictions and safe measures. So it's all kind of accumulating and bottling up. And what we see is a lot of new people coming up with mental health difficulties. It's people who have never had mental health difficulties come up with a lot of anxiety and depression and feeling really negative for the future, hopelessness. And this starts rubbing on to people around them. There's a lot of increase in interpersonal difficulties. We've seen and we have read about a high incidence of domestic violence cases. That's on the rise because of these difficulties. Then you have behavioral changes. Clearly, the substance misuse is on the rise because of the lockdown and social these isolation difficulties. Alcohol increase, all aspects of difficulties. Then this is like people without any mental health background. Then you also have our patients with underlying significant mental health conditions. That population is again significantly hit. A lot of our chronic enduring mental illness, if you like schizophrenia and bipolar, these patients have a set routine which supports them on a daily basis and that keeps them going. They have access to certain groups. They have a carer who comes to them once, twice a week, takes them out for shopping. They have activity groups that are run on a regular basis, and everything is kind of stopped or working at a much lower level and in very different ways. Some patients have adapted better using technology and still accessing some of these support networks. Some are not. So that particular group is also extremely important for us to think of and how we manage them during this pandemic, which is likely to remain for a while.
Thank you, Dr. Naik, for discussing the complex number of factors which are associated with an increase in mental health problems in people who previously didn't have mental health problems, but also those who are known to have mental health difficulties. Are you seeing an increase in admissions for severe mental health problems in the inpatient side, on the mental health hospital side at all, Dr. Naik?
It's been an interesting kind of pattern, if you like. When the pandemic kind of hit us, and when we all started looking into lockdowns and restricted movements, encouraging public to only kind of engage in essential activities and not go out, the actual number of admissions interestingly went down. It also helped us in many ways because we had to kind of close wards, create dedicated COVID wards, because you needed that separation between patients, be able to continue treatment for routine conditions, but also have separate spaces where you can treat the same conditions, but for people with COVID or suspected COVID. So at that time it did go down, and it helped us to kind of enable services to kind of prepare for the worst, if you like. What we have, however, seen 2-3 months down the line now, we are spiking on hospital admissions. A lot of people who manage to cope through the difficulties may be driven by the fear of contracting the virus. Is that in itself has not been enough now, I think. And I think a lot of people are relapsing. And in the last 3-4 weeks, definitely we have struggled for beds. We're continuously working with innovative ways to accommodate people and still give them the best care possible, whether in hospital or outside. But definitely the admission rates have gone up.
Thank you, Dr. Naik. So humbling thought that there are people struggling with mental health problems at the moment. And I think if there's one thing I take away from your discussion today is, well, everybody has a story, and actually, you know, the kindness and compassion that Dr. Bowley Williams was talking about with our children is perhaps something that we must try and sort of demonstrate to each other, particularly when people are, you know, experiencing economic difficulties, social isolation, challenging behavior from children. So I think if anything, you know, I and everybody else needs to be reminded that, you know, smiling, being kind, being polite, and showing compassion to our fellow residents of Leicester is going to go a really, really long way. So thank you, Dr. Naik, for that short discussion on what's going on with adult mental health services and how COVID is affecting adult mental health. A really useful insight there. I'm going to move on to Dr. Rob Hampton, who's a GP, but also specialises in drug and alcohol issues, but also has a specialist interest in occupational health. And we're going to talk about some workplace issues with this, but associated with mental health problems in adults. I'd just like to ask Dr. Hampton about lockdown liver, and I've heard this term, and I understand that you were on the radio talking about this yesterday. Are people, I presume people are drinking more as a result of lockdown. Dr. Hampton, can you tell us about lockdown liver?
Yes, thank you, Dr. Parsi. Well, I think there are several publications out there now that prove that their alcohol sales have increased during the COVID crisis, and many self-reported publications about how people are consuming more alcohol at home. So I think there's a real potential for lockdown liver. And those publications have been backed up by my own personal experience working in drug and alcohol rehabilitation. I work for an organisation called Step Together Rehab that has residential facilities in Arnsby, Leicestershire, and also one in Nottinghamshire. And the demand for their services has really increased. And I've witnessed several cases, probably 2 out of every 3 that I've been seeing recently, where lockdown has been a significant influence on increasing consumption. So people who were coping before, maybe slightly hazardous drinking, had tipped into dependency over the course of a few weeks. And it's affecting people from all sectors of society. I think this is a public health issue that will be becoming more prominent as the weeks and months go on.
Thanks, Dr. Hampton. And you know, what do people do? You know, they're in lockdown, they have their home delivery and they order a few more bottles of wine than they should. You know, 1 bottle becomes 2 and suddenly they're drinking more. They're not noticing any sort of hazardous effects from that drinking perhaps, but they're struggling to cut down. What help is there? What should they be doing in such a circumstance?
I suppose in any potentially harmful addictive behaviour, which this can become, it's about recognising where you are, or more typically, it tends to be family members who recognise that there's an issue here and try and encourage people towards realising that and going into the mode of doing something about it. It has to be self-realisation. There is no marker that people can use typically in day-to-day life to know if they've tipped that balance. Obviously, if people start getting withdrawal symptoms or drinking in the morning or drinking to reduce withdrawal symptoms, we know that somebody is in a dependent pattern of drinking and should seek specialist care. That means a whole swathe of people where their drinking is actually hazardous, affecting liver health potentially, and there's some real data behind this, but not aware that they're causing liver damage because there's no external factors telling them that.
Thanks, Dr. Hampton. And what in terms of the services that are available to support people with alcohol issues and drug issues, where do people go to after they've recognised that there is a problem?
I suppose when you're at the point where you clearly have a dependent drinking pattern, in Leicestershire we have Turning Point that covers free referrals for all people of Leicester and Leicestershire. That tends to be a process of counselling and harm reduction through drink diaries, etc. There is a process of recovery, rehabilitation, detoxification through Turning Point, but that can often take several months. There are various private providers out there, and I have worked with 2 of those. But often people have to invest in their recovery. I think it's just one of the realities of the provision of care at the moment. A good starting point would be Turning Point, though. There are people specialising in alcohol addiction there, and people can self-refer, even if they don't prove to have dependent drinking, but they feel they have a problem.
That's great. Thank you, Dr. Hampton. So it's Turning Point for alcohol issues. You can go to your GP. I'm sure there are some online sort of services which help people to recognise and do something about alcohol intake. So people of Leicester, put down your bottles of wine and just be conscious of how much you're drinking over these hot summery weekends, because I think it's a bit of a sizzler tomorrow. And I think we don't want to be inundated with liver problems a few years down the line. Thank you very much, Dr. Hampton, on the drug and alcohol side. We've got some questions on the chat about workplace issues. And it's actually something really common I've found as a GP. We've got people who have lots of health conditions who are shieldings ending probably August the 17th. Then there are lots of anxieties about moving from the home setting to work. Can you give us a bit of an idea as to the guidance about work in at-risk groups and whether employers have any continuing obligations to protect staff?
Okay, well, I think the obligations on employers to ensure they contribute to the health and safety of the people working for them has remained unchanged. I just think the issues to consider have changed through COVID. And so, in fact, this is it's interesting that there's no shortage of guidelines. In fact, there's no shortage of guidelines out there to guide people, and they come from disparate sources. And so I think in preparation for tonight, I was looking to see whether, just a few that people could be aware of, that would be a real guide, particularly for GPs talking to patients, about the advice that's out there to help. Broadly speaking, when considering any condition, and return to work for shielded patients is very similar. The person's health is a consideration, but also the work that they do, and whether there are reasonable adjustments, workplace modifications, control measures that are reasonable for that the employer to put into place. And this is where the guidance lies. Shall I just briefly outline some of the resources that are there? Yep. So I think of all of the resources out there, the one that I think most people here would want to go and test themselves on is this concept of people's COVID age. And therefore that gives you an idea of the risk category that you are in. And this resource is being put together by the Association of Local Authority Medical Advisors and together with 2 or 3 other occupational health bodies. And it looked at all the evidence, and within that there's actually a spreadsheet that's been Michelle Moore, a specialist nurse in Herefordshire, had put this together to put those guidelines into something that you can just put in your age, your ethnicity, any health conditions you have, to see what COVID age you are, and therefore what risks you will have within the workplace. And it's something very tangible that you can then take as a patient to the workplace to discuss the adjustments that have to be made for you and your particular role. If we combine that with the Society of Occupational Medicine now has a framework and a toolkit that has a 9-point checklist to look at you, the work you do, the environment you work with, people you serve, and the work you do with colleagues, to then see where your risks are and come up with a framework for whether a return to work is feasible, and if it is, what control measures have to be put into place. I guess thirdly, in the NHS, we must recognise here in Leicester, we've been at the forefront of providing advice to NHS workers. Professor Brown has been one of 3 doctors here, Professor Conti and Dr. Anderbono, put together, have been a part of the group, have put together guidelines for NHS workers who we know have had a particular issue around risk in returning to work in recent weeks and months.
That's great, Dr. Hampton. Thank you very much. I think what we need to do is perhaps after this webinar is send all of the resources that are available from all the experts in this particular panel, because there seem to be lots of resources that people can self-help from: occupational health, child mental health, adult mental health, so on and so forth. Thank you, Dr. Hampton, for your input. I'm going to go to Professor Brown, and I'm wondering if there are any updates on the Leicester lockdown, because we've been on tenterhooks all day. Is there a update on the Leicester lockdown at all? I know.
I have been. Some people may have seen my camera switching on and off every now and again to have a check. So we haven't seen anything yet. So this now means that we're going to have to pull this together again at some point.
Thank you, Prof. Brown. I suppose it's the powers that be that are making decisions on the best interest for all of us in Leicester. I think we've been running for a few minutes now. We've had a really important and useful discourse from a wide variety of frontline NHS clinicians delivering care to where it's needed most. So first of all, I would really like to thank our panel today, who've taken time away from their busy schedules and really helping the people of Leicester to come away and help the people of Leicester in a different forum on this really sunny evening on Thursday. So thank you very much to all of our panel members. What we will be doing is getting some resources across to the thousands of people who have subscribed to the webinars over the 2 webinars that we've had. Thank you very much to the people of Leicester who have logged into this webinar. And I think we've shown that as a city we're tremendously resilient, and I'm pretty sure we can come through this positively. Also with the knowledge and with the humility to know that we've had lots of people die within our great city. So there's a few resources that you could really go to. There's the Willows Healthcare website, and on there you'll see some YouTube videos of the previous webinar, and there are also some videos in 13 different languages which talk about coronavirus. We'll be sending you out some further sort of links and support to all the email addresses that are registered to this webinar. Thank you very much for joining us. Follow us on Twitter, Facebook and Instagram, because it's going to keep you engaged. And have a great evening. Stay safe, wash your hands, socially distance, and follow Prof. Brown's advice, because that's the only way we're going to get out of this. Thank you all.
Thank you all very much.